Hello, today I'm going to show you a couple of exercises to relieve a pinched nerve pain on your neck. So sometimes the nerves can be pinched on your neck and usually you might feel a sensation going down to the arm. So it can be a shooting pain, it can be a radiating pain, it can even be a numbness, tingling sensation, or even pins and needles going down to the fingertips. So with these exercises you will be able to relieve the pain and you should feel better. The first exercise is a McKenzie exercise. Maybe you've heard about McKenzie exercises. You can do them for the lower back when you have a pinched nerve or a disc herniation in the lower back. So in the same way, you can do it for the neck as well. So what you have to do, from here, keep the back straight. So try to sit up straight, 2 fingers on your chin, and from here we make a double chin. So we push our head backwards, but you have to keep the head straight. So you look straight horizontal. You don't look down and don't look up, okay? So don't change the angle of the spine. So from here, pull it inside and back. And relax. You can even hold it for 5 to 10 seconds. Keep breathing and relax. So from the side you do like this. So try to keep the back straight. 2 fingers and relax. Perfect. Hold it, 10 seconds, keep breathing and relax. So you keep the head straight, you just move it forward and backwards. This is the stage 1. For the stage 2, we do the same movement, but this time we'll add a bit of extension, so we will have to look up with the head. Again, fingers on the chin, make a double chin, so push it backwards, and from here, slowly look up, hold only 1 or 2 seconds, and then back again. And relax. And again, chin in, up slowly, down, and relax. In, extension, and relax. You can hold it only up to maximum 2 seconds, don't hold it too much, it can be painful. The last stage, the third stage, is the same exercise, but now we will have to add a bit of side flexion, so tilting the head to the side slowly, very, very gently. Again, stage 1, then stage 2 with extension, and from here we tilt to the left and to the right and back and relax. Very gently. Stage 1, in, look up, and then to the side, other side, come back and relax. So you pull it in, you look up, tilt to the side, back, down, and relax. So these are the 3 stages for the McKenzie exercise. Obviously, you have to do it gently, so you need to start with stage 1. If you don't feel any pain going down to the arm or excruciating pain, immediately it's alright to progress to stage 2. But if you feel that you are reproducing the pain with stage 2, so you feel the numbness, the tingling, the pins and needles going down to the hand, you will have to stop and just stay at stage 1, do the stage 1 for a couple of days, and then move on to stage 2. So we don't want to rush it, the body will tell you if it's too much because it will be too painful, and we don't want to create again the pain, the pinched nerve sensation that the pain goes down to the hand or numbness, pins and needles. Now we have to get rid of the pain that goes down to the arm. So I was talking earlier about the pain that you feel it radiating from the top, from the pinched nerve going down to the arm, like numbness, pins and needles, or even tingling sensation into the fingers, into the hand. So to do that, we need to stretch the nerves. So we've got 3 main nerves. We've got the median nerve, we've got the ulnar nerve, and also the radial nerve. So we will start with the median nerve. So the first exercise, keep the back straight. You have to lift your hand like this, keep the elbow straight, palm up, and from here, just drop your hand and your fingers down. So we do an extension on the wrist, and you can hold it there for 10 seconds, and then come back. And you do it again, hold there, 10 seconds, and relax. And you will feel a pull coming from the shoulder down to the arm, even down to the fingertips. And come back. And you relax. So this is a stretch for the median nerve. Now, this is a static stretch. We can do nerve flows. So it's more like a dynamic stretch. And we do the same movement. So palm up, hand up with the elbow straight. And from here, when we drop the hand down, we tilt the head to the same side. So it will be like this. And then we come back we add flexion into the wrist, so fingers up and head tilted to the other side. And then we can move it slowly together. And you will feel a pull again going down to the hand. It's a bit different than the previous one, that was a static stretch. And you can just do it maybe 5-10 times. And you relax. So this was for the median nerve. Now we have to stretch and to move a bit the ulnar nerve. So what you have to do is keep the back straight. We make the OK sign like this, hand up like this. So we could do abduction on the shoulder, elbow flexion at 90 degrees, and from here drop your hand down like this towards your face. And you will feel immediately a pull going down to the arm. You can hold it there a couple of seconds and then come back in the initial position and do it again. Hold it there and relax. If you want to do it a bit more, you can do the same thing, and now you push your elbow a bit backwards, and now you will even stretch a little bit more. You hold it there and relax, and do it again a bit backwards and relax. To do a nerve flossing, so a dynamic stretch, you do the same thing, and from here we can tilt the head to the opposite side slowly and back. One more and relax. And again, you can do it 5-10 times. Again, don't push it too hard. So start with the first stage, when you just stretch it a little bit gently, hold for 5-10 seconds, and then you can move into the nerve flossing, more like in a dynamic stretch. The last nerve to stretch is the radial nerve. So again, back straight, hand up, 90 degrees abduction, and from here you have to turn your thumb down, so thumb to the floor. And now you make a wrist flexion. So you push your fingers backwards, and from here you let the arm drop slowly and you go a little bit backwards as well. And this time you have to twist your hand, so you push your fingers away from you until you feel the pull on the arm. You keep the back straight, you hold it there a couple of seconds and relax. And you do it again. So thumb down, flexion on the wrist and twist. So push the fingers away from you and you hold it there. If you want to move into the nerve stretching, dynamic stretching, nerve flossing, so from here we can do bend it to the side, and then when you go on to the opposite side, you relax the hand in neutral, straight, and you go again. Slowly control the movement and then relax. So this is more like a nerve flossing, like a dynamic stretch on the nerve. So now you have the stretches for the median nerve, for the ulnar nerve, and also for the radial nerve. So this exercise will help you to get rid of the pain that goes down to the arm. I hope these exercises will help you to reduce the pain on your neck and also to get rid of the pain that goes down to the hand. If you like this video, give me a thumbs up. If you have any questions or any suggestions, don't forget to leave me a comment. Subscribe to my channel, and I will see you next time.